Hey, have you heard the joke about pneumococcal disease?
No, I haven't.
That's good, because pneumococcal disease is no laughing matter. Pneumococcal disease can cause a variety of illnesses in humans, and that's important because we are humans. Well, not you, Coco. Ask me anything about pneumococcal disease. Not you. You.
What disease can be caused by pneumococcus in humans?
I'm glad that you asked. Pneumonia, middle ear infections, sepsis, and meningitis, just to name a few. In many people, the infections caused by pneumococcus are not very serious and will get better quickly with antibiotics. But in patients who are immune compromised or very young, more serious issues can occur, various complications can occur, which could lead to loss of hearing, loss of limb, and in the worst cases, loss of life.
I haven't been feeling well lately. I have a fever. I have a horrible cough. I have chills. I have aches and pains all over.
Really?
Yes.
Well, you did get the pneumococcal vaccine, didn't you?
I thought that was for only people over 65 years of age or older.
No, that's not the case at all. Anyway, I know you have asthma. Anybody with a condition, asthma or other lung disease, people with kidney disease, liver problems, variety of other things, those with cancer or those who've been put on immunosuppressant drugs after an organ transplant, any of those people would be at risk for pneumococcal infections and even serious infections at times. And for them, it would be important to get that vaccine.
I've been around my 5-year-old son a lot, and I'm a little worried. Could he be at risk, and should he be getting the pneumococcal injection?
Well, if he's 5 years old, he's probably been vaccinated already. About 10 years ago, it became pretty common practice to vaccinate kids between the ages of 0 and 2. They get a series of, I think it's 3 or 4 vaccinations. But you should probably check with your pediatrician. If he hasn't had the vaccination, he may not need it unless he's at higher risk. If he's got a condition, asthma, another lung problem or chronic condition, then he maybe should get the vaccination.
Okay, I'm not really sure if he had it. I'll check with my pediatrician. I know he's gotten a number of injections, but I'll call and I'll check.
Okay,
Okay,
yeah,
sure.
do that and then let me know and I'll give you
Okay.
some advice.
Okay.
Oh, you're back.
I've been near my rabbit a few times when I was coughing. Is there an injection, a vaccine for rabbits?
A pneumococcal vaccine for
Yes.
rabbits? That's a great idea. And actually, no, it's not available.
Oh. I heard vaccines can be risky. Is it safe for me to get the pneumococcal vaccine? And especially, is it safe for my child?
That's a good question. And a lot of people feel that vaccines are unsafe. There are a lot of rumors that go around about vaccination. But let me dispel a few of the rumors. What happened to that damn rabbit? Keeps disappearing, reappearing. But anyways, back to the rumors. A lot's been said about a connection between vaccination and autism. Many studies have been done. The rate of autism has increased, but there have been no studies that have definitively tied vaccination to autism. And I would say that's really not a significant concern. Another thing that we've heard is that patients getting the pneumococcal vaccine are at increased risk for pneumococcal disease, but that is also not the case, and so that's not something that you should worry about. There are a couple of genuine concerns, but most of them are minor. Most common reaction that we see is a local skin reaction, a little swelling, inflammation, pain, and redness. Usually passes within 2 or 3 days and really isn't much to worry about. Some patients can get nauseous or even vomit, usually again a very limited reaction and goes away usually within a few hours. Another thing we can see is fever, mostly low-grade fevers, but occasionally patients can have fevers 102, 103. Anything higher than that, and I would say that's a reason to go back to your doctor. But that occurs in less than 1% of cases. You know, when all is said and done, for patients who are at risk, pneumococcal disease can be serious and can lead to significant consequences. And for a person like that, it is a no-brainer. You really should go for the Pneumovax or pneumococcal vaccine. Although there are risks, in general they've been overblown, and I think the risk-reward ratio is great. So I would strongly suggest that you and your child make sure that you're vaccinated. So remember, If you or someone you know is at risk, talk to your doctor. See whether you should be getting the pneumococcal vaccine.